Gallant or Galan?
Yes, I'm Vicky Golani, and I'm a speech language pathologist. I'm going to play you the following.
Again, I give you the options on where you can email, you can fax, or you can send your concern.
That is not giving me a process for filing a formal complaint. That is reiterating what I already know about how to provide testimony. I need the process and the option for filing the complaint.
I'm giving you the process and the options, and so at this time I can either give it to you, or if there's nothing else, then I can thank you for calling the office and give it.
Okay, so the only option I have is to provide comment. I cannot file a formal complaint with HHSC. Is that what I'm being told?
I'm trying to give you the way how to file it. I have address, I have an email address that you're able to send your concern. Yes.
So then on the day of the hearing, is the hearing committee going to actually answer questions during the hearing?
I cannot answer that for you, ma'am. That's something when you go, you can ask them once you get there.
I already know what that they will say, but there is supposed to be an option that HHSC, when you contact the Office of the Ombudsman, allows for a process for filing formal complaints.
Yes, ma'am. And we were informed that about these cut rates, we were informed to give you ways on how to file these complaints. And that's what I'm trying to give you, that if you're not going to take it, then at this time, is there anything else that I can assist you with?
No, but I want it to be clearly understood that a testimony is not a means of providing a complaint. My name is Vicky Golani. I am a speech language pathologist, and the conversation I played is one of 17 that I recorded and occurred between the dates of 4/12/2017 and 5/24/2017, weeks during which Star Kids and HHSC reported providers and members made 0 complaints regarding therapy rates to the Office of the Ombudsman. 0. It reflects the number of HHSC members who were able to register my complaint or provide me with a process for doing so. 0. The number of times you were able to help me or my colleagues when we called in to express how these rates impact the patients that we serve. 0. The number of times you were willing to assist my families when, as a provider, we were no longer able to provide their children with services due to issues with their MCOs. 0. The number of times we had a question answered or a concern heard. 0. The number of times HHSC showed concern or regard for my patients. Patients like Cheyenne, who want to be able to move, like Ulysses, who wants to be independent, like Isaiah, who wants to make his own choices, or like 13-month-old Sophia, who wants to be able to eat. 0 reflects my willingness to trust your data. You ask what ethics is? It's reporting accurate, evidence-based data. I'm required to report accurate, evidence-based results when I submit assessments, notes, and POCs to the MCOs. Why isn't HHSC or the MCOs held to the same standards? This isn't data. To describe it as inaccurate is a gross understatement. And if you persist with publishing your data, I'll persist with disproving it. I will release my recordings and complaints to every news agency, every media outlet, and every legislator in this state who has been given this report by the commissioner during the past legislative session. Because 0 is the number of times I'm willing to sit back and allow this commission to make decisions for my kids without concern for their livelihood.
Thank you. Yes. Sure.
Hi, thank you for your testimony. So I was looking at this list. According to this, as of October 27th to end of May, there have only been 4 complaints on member-provider Medicaid therapy rates. And I'm sure I was one of them. So there's one. Who are the other 3 people that did it? I agree. I think this information looks inaccurate.
Only one of them was actually reported to have been made by a provider, and that was in the week of, I think it was November It was sometime November 2016. So all the other complaints, whoever that lucky provider was who got their complaint heard, I mean, there have been none others recorded.
Yeah, it's a hot issue. I feel like we need better data.
I agree. I agree. Thank you for providing your comments to us. And yes, one more quick question.
I thank you for bringing this forward to us. You said you made 17 calls. Were they all to the Office of the Ombudsman?
So when I've contacted the Office of the Ombudsman, many times I have been told, and I have other conversations that I can play, but for the sake of time, I decided not to do that. But those conversations, I am being told, I start off calling the Office of the Ombudsman stating that I want to file a formal complaint regarding therapy rates. No one in the office is able to provide me with an option or process how to do that. They sometimes think, oh, okay, I can redirect you. Let me transfer you to this next person. I mean, I've been transferred all the way to rate analysis and spoken to Megan Wolf. And regardless, the only option I've been told is to provide testimony, that is my means of providing complaints. So I was present during the May 24th hearing, as were, I want to say it was 175 people who provided testimony. And I want to know why those numbers are not being reflected also as part of the complaints, if that really is the only option for filing a complaint.
Well, that is not the only option for filing a complaint. So first I want to know, I want to make sure I know who to follow up with in terms of, it seems like we might need to do some internal HHSC education around the work that Rudy is doing related to tracking complaints, and our sister partners with the Office of the Ombudsman, and really make sure that we're helping families in the way that, we're saying over here, this is what you need to do, but then that's not the message you're getting when you call a different number. And I want to make sure that what you have called in about is reflected in our numbers, because it sounds like it should be, right? That you were trying to get on our data sheet. I mean, more than that, you were trying to get help for families, and so I appreciate that too. But I want to make sure that our data is accurate, that it is capturing all of the places. I mean, that's our intention. So if there's a place where we're missing it, then we want to fix that. So that my first step will be to follow up with our partners at the Office of the Ombudsman. Do what? Oh, yes, and it sounds like I have your information, so I can follow up with you as well.
Sorry, so then who would I call when I have a complaint? Because so far, I mean, my methods of calling the Office of the Ombudsman haven't worked.
And what I'm saying is that should be one of the methods. You should be able to call them, and that complaint should get tracked. So I want to do some education there with them to see what happened, and make sure that the next time anyone calls into them with this kind of issue, that it is captured, and that you're not being told to do something else. So that you should be able to do that. You can also submit, I think, another place that Rudy is looking, I think he's already left the room to confirm this, but is through our health plan management complaint mailbox, hpm_complaints@hhsc.state.tx.us. So that is another place to register that. Oh, good. I'm getting a head nodding, so good. So that is another place where this can get captured.
Right. The only thing that I have is I just don't want it to be lost in the process, right? Because, I mean, my other options besides showing up at the public rate hearings have so far been to fax in my testimony or my complaint, right? But that's still not being reflected in the data because, I mean, like I said, during the last public rate hearing, we had several people who wrote in and provided testimony, and those numbers are not being reflected.
I do think I'll go back and just double check with team and leadership, but I agree that what was presented at that rate hearing should also be captured in our processes. So I will take that back as well.
Quick comment. This is Dr. Medellin. I did, after one of the last meetings, I did try to call the Ombudsman line to raise some complaint concerns, and I was told that they didn't take any concerns from providers, that I needed to call the provider lines. And so, I was not able to log my complaint with them because they did not really ask. I have a patient that I have these and these issues with. And they directed me back to TMHP, and TMHP couldn't help me, of course, because this was an MCO line. So after a couple of tries, I stopped trying to call the Ombudsman.
Okay, so we obviously need to fix this issue. So we'll start with making sure that your complaints are captured, and then we will work internally to make sure that we have all the right people educated about what providers can do.
Right.
It sounds like that may be the breakdown is where can a provider go to log these complaints?
Yes, but I think it extends beyond that, just providers, because we've had families, like I've stated, that we are no longer able to work with their kids because of issues with their MCOs, and they've contacted the Office of the Ombudsman in order to file their complaints. And what we're getting back is that they're being told each and every time that is an MCO issue, contact your MCO. So even their complaints are not being reported in the access to care issue that really should be at the forefront when we discuss these therapy rates.
I agree.
Thank you.
It's Diane Kearns. Can you put the email address that you mentioned, because I didn't write it fast enough, on the Star Kids page, like under the number for the Office of the Ombudsman?
Yeah, we can. I'm surprised it's not already there, but we'll.
It's just the phone number
Oh, okay. So
on the website.
So the email address I was speaking of is our health plan management unit, our complaints resolution. But yes, we can also get that up there as well.
Okay, thank you.
Yes.
Thank you for your comments.
Thank you.